Good morning, everyone. Today, we'll be dealing about the respiratory system, and in the respiratory system, we'll be studying about the physiology of respiration or the mechanism of respiration. So, first of all, what is respiration? Respiration is nothing but the process of exchange of gases in the body, and the process of respiration is mainly divided under three headings. First one is the pulmonary ventilation or breathing. Second one is the external or pulmonary respiration, and the third one is the internal or the tissue respiration. So in case of pulmonary ventilation or breathing, it is defined as the inhalation and exhalation of air between the atmosphere and the alveoli of the lungs. The external respiration is defined as the exchange of gases between the alveoli and the blood and pulmonary capillaries across the respiratory membrane. The internal respiration is the exchange of gases between blood and systemic capillaries and tissue cells. The pulmonary respiration, it includes two steps. First one is the inhalation and second one is the exhalation. Inhalation is also called as breathing in or inspiration. So just before inhalation, the air pressure inside the lungs is equal to the pressure of the atmosphere, that is 760 mmHg. For air to flow into the lungs, the pressure inside the alveoli must become lower than the atmospheric pressure. So this condition is achieved by increasing the size of the lungs. Now, how can we increase the size of the lungs? That can be achieved by three methods. First one is the contraction of the diaphragm. So the diaphragm is a dome-shaped skeletal muscle which forms the floor of the thoracic cavity. The diaphragm, once it contracts, it flattens from its dome-shaped structure. This increases the diameter of the thoracic cavity. So in case of a normal inhalation, the diaphragm descends about 1 centimeter, thereby decreasing or producing a pressure difference of around 1 to 3 mmHg, and that results in normal inhalation of around 500 ml of air. In case of forced breathing, the diaphragm may descend about, that is forceful respiration, the diaphragm descends about 10 centimeter and creates a pressure difference of 100 mmHg, and the inhalation increases to 2 to 3 liters of air. The second process is by the contraction of external intercostal muscles. So during inhalation, the external intercostal muscles contract, that elevates the ribs and increases the anterior, posterior and the lateral diameters of the chest cavity, and thereby it increases the volume of the thoracic cavity. Third method is by the intrapleural or the intrathoracic pressure. So during inhalation, that is during normal inhalation, the pressure between the two pleural layers in the pleural cavity, called as the intrapleural pressure, is lower than the atmospheric pressure. So just before inhalation, it is around 756 mmHg, and the diaphragm and the external intercostal muscle starts to contract, and the overall size of the thoracic cavity also increases. Volume of the pleural cavity also increases, thereby leading to an intrapleural pressure which decreases to about 754 mmHg. The parietal pleura of the pleural membrane is pulled outward, and the visceral pleura and the lungs are pulled along with it. Thereby the volume of the lungs increases and the pressure inside the lungs drops to around 758 mmHg. So these are the main processes that help in inhalation, wherein the volume of the lung cavity is increased. Now the next step is the exhalation. So exhalation is nothing but breathing out of the air or expiration. So it is a passive process where no muscle contraction is involved, and mainly it occurs due to the elastic recoil of the chest muscles and the lungs. Also, the surface tension of the alveolar fluid is one of the factors which helps in exhalation. So in case of normal exhalation, it starts when the inspiratory muscles start to relax and the diaphragm relaxes. external intercostal muscles also relaxes. Whatever we're contracting during inhalation everything starts to relax. So this relaxation of the inspiratory muscle, diaphragm, and the external intercostal muscles, everything causes a decrease in the vertical, lateral, and the anterior-posterior diameters of the thoracic cavity, and decreases the lung volume. The alveolar pressure also increases to around 762 mmHg, and the air starts to flow out. Next one is the forceful exhalation. So in case of a forceful exhalation, the abdominal and the intercostal muscles contract. Contraction of the abdominal muscles compresses the abdominal viscera, and this forces the diaphragm to move slightly upward, which increases the intrapleural pressure. That further causes the decrease in the lung volume. It increases the pressure within the lungs, and that causes the exhalation. Now, next we'll discuss about some of the factors which affect pulmonary ventilation. So in case of pulmonary ventilation, the factors which affect it are the air pressure difference, surface tension of the alveolar fluid, compliance of the lungs, and the resistance, airway resistance that is offered. So air pressure difference, that we had already discussed, the changes in the air pressure, how it is caused, and how much of a difference it is producing. Then in case of surface tension of the alveolar fluid, a thin layer of the alveolar fluid, it coats the inner surface of the alveoli, and it exerts a force known as the surface tension. Now during breathing, what happens is that surface tension must be overcome to expand the lungs during each inhalation. And the surface tension is what helps in elastic recoil during exhalation. So it is one of the factor which is contributing to pulmonary ventilation. And the third factor is the compliance of the lungs. So compliance of the lungs means how much effort is required to stretch the lungs as well as the chest walls. Like high compliance means that the lungs and chest walls expand easily, and low compliance means that they resist expansion. So a decreased compliance could mean a disease condition like tuberculosis, pulmonary edema, or deficiency of the surfactant, etc. Then comes the airway resistance. So airway resistance meaning the airflow. There is a resistance that is offered once the air is flowing through the respiratory system. So the resistance is calculated by airflow equals the pressure difference between the alveoli and the atmosphere divided by the resistance. So that is the equation for it. And next, we'll be dealing about the external respiration and the internal respiration. So in case of the external respiration, it is the pulmonary gas exchange, and it is also called as the pulmonary gas exchange, and it is the diffusion of oxygen from air in the alveoli of the lungs to blood in the pulmonary capillaries, and the diffusion of carbon dioxide in the opposite direction. So these exchanges, be it external respiration or internal respiration, the exchange of oxygen and the carbon dioxide is based upon the partial pressure difference. So in case of external respiration, oxygen diffuses from the alveoli, where its partial pressure is 105 mmHg, into the blood in pulmonary capillaries, where the partial pressure of oxygen is only 40 mmHg. So the diffusion continues until the partial pressure of oxygen in the pulmonary capillary increases to partial pressure of oxygen of alveolar air, that is 105 mmHg. And while the oxygen is diffusing from the alveolar air into the deoxygenated blood, carbon dioxide is also diffusing in the opposite direction. So the partial pressure of carbon dioxide in the deoxygenated blood is around 45 mmHg, and that of carbon dioxide in the alveolar air is around 40 mmHg. And carbon dioxide, partial pressure of carbon dioxide from blood to alveolar, the diffusion of carbon dioxide from blood to alveoli continues until the PCO2, that is a partial pressure of carbon dioxide of the blood, decreases to around 40 mmHg. So that is regarding the external respiration. And the next one is the internal respiration. So in case of internal respiration, it is defined as the exchange of gases between systemic capillaries and tissue cells. And the internal respiration, it occurs in tissues throughout the body. So here also partial pressure is acting. So over here, the partial pressure of oxygen in the systemic capillaries is around 100 mmHg, and partial pressure of oxygen in the tissue cells is around 40 mmHg. So the oxygen, due to this pressure difference, the oxygen, it diffuses out of the capillaries into the tissue cells, and blood, uh, the partial pressure of oxygen in blood, it drops to 40 mmHg. Then the partial pressure of carbon dioxide of cells is around 45 mmHg, and in the systemic capillary it is around 40 mmHg. So the carbon dioxide diffuses from the tissue cells into the blood until the pCO2 in the blood increases to 45 mmHg. So that is regarding the external and internal respiration. And next we'll be dealing about the different factors which are affecting the external and internal respiration. So first one is the partial pressure difference that we had already discussed. Second one is the surface area. Third one is the diffusion distance, and fourth is the molecular weight and solubility. So in case of partial pressure difference, the rate of diffusion is faster when the difference between partial pressure of oxygen in alveolar air and pulmonary capillaries of the blood is larger. So diffusion is slower when the difference is smaller. The partial pressure of oxygen and carbon dioxide in alveolar air depends on the rate of airflow into and out of the lungs. So next factor is the surface area. So the rate of diffusion, it is directly proportional to the surface area, and in some disease conditions like emphysema, it decreases. The diffusion distance, that is the distance the respiratory gases should travel for the gaseous exchange, and the diffusion distance is inversely proportional to the rate of diffusion. Fourth factor is the molecular weight and solubility of the gases. Oxygen has got a lower molecular weight than carbon dioxide, so it diffuses 1.2 times faster than through the respiratory membrane. But the solubility of carbon dioxide in the fluid of the respiratory membrane is around 24 times greater than that of the oxygen. So the net outward carbon dioxide diffusion occurs 20 times more rapidly than the net inward oxygen diffusion. So these are the few factors which are responsible, which are affecting the external and internal respiration. So the factors were partial pressure difference, surface area, diffusion distance, and the molecular weight and solubility. So we'll be learning one more additional point, that is the transport of oxygen and carbon dioxide. So in case of transport of oxygen, oxygen is transported by either dissolving in plasma or by combining with hemoglobin. So around 98.5% of oxygen is transported by combining with hemoglobin in RBC, and the remaining 1.5% is dissolved in plasma. And each 100 ml of oxygenated blood, it contains around 20 ml of oxygen. And the heme portion of the hemoglobin, it contains 4 atoms of iron and is responsible for binding to 4 oxygen. And the oxygen in hemoglobin, it binds to form the oxyhemoglobin. That is the reduced hemoglobin, deoxyhemoglobin plus oxygen. And once it binds, it forms the oxyhemoglobin structures. Now, the different factors which are affecting the affinity of hemoglobin for oxygen, they are the partial pressure of oxygen, acidity, ppg, temperature, and pCO2. So, partial pressure of oxygen, if the partial pressure of oxygen in the blood increases, the affinity for hemoglobin also increases, and if the acidity increases, the affinity of hemoglobin for oxygen decreases. And BPG, It is an intermediate of glucose metabolism, that is 2,3-bisphosphoglycerate. And when BPG combines with amino acids of the hemoglobin, it causes alterations in the hemoglobin structure, and oxygen is liberated out from the hemoglobin. Next is the temperature. So once the temperature increases, the affinity of hemoglobin for oxygen decreases, and oxygen will be released from the hemoglobin. And lastly, it is the partial pressure of carbon dioxide. When PCO2 rises, the affinity of hemoglobin for oxygen decreases. Next is the transport of carbon dioxide. Um, Around 100 ml of deoxygenated blood, it contains around 53 ml of gaseous carbon dioxide, and it is transported mainly by three methods. One is by dissolving in plasma, second is in the form of carbamino compounds, and lastly, around 70% is transported with the help of formation of bicarbonate ions. So, in case of dissolved in plasma, the around 7% of the carbon dioxide is dissolved in blood plasma, and thereby it is transported. In case of carbamino compounds, around 23% of the carbon dioxide it combines with amino groups of the amino acids and proteins in blood to form the carbamino compounds. Then, in case of bicarbonate ions, they are responsible for transporting the maximum amount of carbon dioxide, that is around 70% of the carbon dioxide is transported in blood plasma in the form of bicarbonate ions. As the carbon dioxide diffuses into the systemic capillaries, it enters the RBC, which reacts with water in the presence of the enzyme carbonic anhydrase to form carbonic acid, which dissociates into H plus and HCO3 minus. So that is about the mechanisms of respiration. We discussed about what is pulmonary ventilation, external and internal respiration, what are the different factors that are involved in external, internal, as well as in pulmonary respiration. And also we discussed about the transport of oxygen and carbon dioxide, and also the factors which are uh, resp- um, affecting the affinity of hemoglobin for oxygen. So that is regarding today. That is all about today's topic.